Good morning, sister. Good morning, students. I, Pratishtha Nigam of BSc second year, is going to give my class presentation on a topic. I'm going to give you a hint that we all had posted for the district hospital posting in Sitapur Hospital for 1 month. There, we had taken a patient for giving or providing care for 5 days. So that is known as case study, and after that, after taking that case study, after presenting, it is called case presentation. So there we had taken case studies and case presentations. So today my topic is case study and case presentation. So nursing case study provides us the means to examine, analyze, and learn about the patient as an individual as a result of care provided by the V nurses. The focus of this case study is not only to provide care inside the hospital, but after the discharge, after the patient goes home, then also the care should be provided. Means there should be a continuity to provide care to the patient. Then these case studies are used by the nurses, by the student nurses, to provide care to the patient or to improve the patient care to for upgrading the nursing education or to increase the medical awareness through the ongoing researches which are going on, and to introduce the new equipments. So what is the definition of this case study? The definition of the case study is a case study is a detailed analysis, as it is an in-depth study. So a case study is a detailed analysis of a person or a group, especially as a model of medical, psychosocial, psychological, or social phenomena. Thus, a nursing case study is an in-depth study, means we are studying it in very deeply. We are going inside the anatomy and physiology, and we are talking about the disease condition and about everything in the disease, means what is that symptoms, about what are the causes of the disease, then what is the main cause for that patient and that causes that disease inside the patient's body. So it is an in-depth study of the case or a disease to analyze the nursing problems which are faced in the day-to-day life of the patient, day-to-day life of the nurses. So what are some of the day-to-day problems of the nurses which are related to the disease conditions, like diagnostic procedures and its findings, medical treatment, diet, safety, psychosocial aspects, and after treatment rehabilitation, etc. So, what is the definition of this case study? A case study is a detailed analysis of a person or a group, especially as a model of medical, psychological, and social phenomena. So, there are few steps of case study. The teacher should provide guidelines that how the case study is being conducted. So the teacher should conduct a nursing case study so that the students be familiar with the case study, that how that case study is conducting. So the teacher should provide some guidelines to the students that these things are included in the case study. So those things are the guidelines which the teacher should provide to the students are about the patient selection according to the priority. As we know that if there are 3 patients, one is having abdominal pain and is having acute splenomegaly, one is having abdominal pain, another one is having tuberculosis. So our priority is that we should take the tuberculosis patient first, because that patient is serious and that patient needs more care in comparison with those 2 patients. So selection of patient according to priority. And then another one is involvement of patient and the bystander of the patient, that how that patient is involving himself or herself, and how those bystanders are helping the nurses to give care or to provide care or to do any procedure to the patient. Okay, so then what is the role of the teacher in that case study? What is the role of the teacher in that case study? What are the types of care which should be provided to the patients? Then what are those things, that how those procedures are applying, that how those procedures, or how those that care is implemented on the patients. Then about the evaluation, that how that case study is evaluated, means criteria of evaluation should be told to the students before conducting the case study, so that the students become familiar with that process. So there are two parts of case studies. The first part of case study includes the patient. The patient means that the involvement of patient and about the patient, like the case study focuses information and facts about the patients, the history of patient, and the history of patient, the condition of patient, about the present illness, about the sign and symptoms what patient is having, about the past history, means about if any patient is having any surgery before, or if patient is having any serious medical condition before. So about those things, or about bad habits, that patient is smoking or drinking, bad habits, those all things are included in the history collection. So the first part of case study includes the patient, about the detailed information of the patient, which is to be taken by the patient or from the bystander of the patients. Then after collecting those informations, how that information is applied on the how that information is applied in that case study, those all things should be taught by the teacher to the students before conducting the case study. Then the second part of the case study is including the nurse or the student who is performing that case study. So the first part is including the first part of case study includes the detailed information about the patient, about the history, past history of the patient, medical or surgical, about all the history of the patient, then about the present condition of the patient, about the disease, the anatomy and physiology and the disease condition, about the sign and symptoms, causes and diagnosis, and what diagnosis patient, what is the diagnostic evaluation of the patient, what diagnosis patient is having, and what all are the tests or the diagnostic evaluations, or what are the medical diagnosis what patient is having, and what is written in the book. Those all things is to be included in the first part of the case study. Then second part of the case study includes the nurse or the student or the person who is conducting that case study. So the second part is including the nurse for nurse's responsibility for providing the care, for planning the care. And first the nurse is assessing the patient carefully, then according to the assessment, the physical examination and about the assessment of the patient, according to that, on the basis of the assessment of patient, the nurse is planning that what is the care or what should be the care which is to be given to the patient. Like for example, the nurse should give a care like back rest or position to the patient, or back rest to the patient, or IV fluid, or the administration of medication to the patient. So these all things are included in the second part of the case study. And then after giving all the care from first day to the fifth day, after the treatment, the rehabilitation of the patient, after the patient, if the patient stays in the hospital, then, or if the patient is going out, or if the patient takes discharge, then also the continuity of care should be there. So there are two steps of case study. First, the teacher is providing or guide the teacher is guiding the student that how that case study is conducted. Then after, the teacher should be there with the student nurse to select the patient according to the priority. Then third is that the nurse should assess the patient carefully, and according to the assessment of the patient, the nurse should means evaluate or examine that what all are the care which should be given to the patient. Like, this patient is having backrest and the position and IV fluid is connected, so these type of nursing care should be given to the patient, or the administration of the medications. Then after the fifth day of the case study, if the patient is discharged, then the rehabilitation of the patient and the care of the patient should be continued after the discharge also. So these all are the steps of case study. So we are moving towards another thing, that is uses of case study. What are the uses of case study? That how we are using, or how case study is using in the nursing field. So there are some uses of case study. So let's see what are the uses of case study. So uses. The first use is better understand the patient. It helps the case study helps the student for better understanding the patient. As in those 5 days of case study, the patient is talking with that nurse, and the nurse is able to understand more about the patient. So it helps the student nurse to better understand the patient. Then second is improve skills. It gives an opportunity to the student nurse to improve the skills in the field of nursing. As a student nurse is assessing each system again and again by taking case studies, so it improves the skills in the field of nursing. Then recognize various factors. Recognize various factors or causes. It helps the student nurses to recognize the various factors or causes responsible for causing the illness in the patient. So it helps the student nurse to recognize various factors which are responsible to cause the illness in the patient. Then fourth is self-expression. It gives the student nurse to an opportunity for self-expression. Then fifth is patient as unique individual. As we know that every person is a unique personality, every person is having a unique individuality. So we have to see that patient as a unique individual. A student should see the patient as a unique individual, as every person is having different types of preferences or different types of needs. So a student nurse should see a patient as a unique individual. Then sixth one is coordinate with others. It helps the student nurse to coordinate with other health workers, or it helps, or it gives an opportunity to a student nurse to act as a leader among that all health workers. So it gives an opportunity, or it helps the student to coordinate with other health members like nutritionist or pharmacist or doctors or etc. So these all are the uses of case study. There are 6 uses of case study. Better understand the patient. In better understanding the patient, then improve skills. It gives an opportunity to a student nurse by assessing each system of the body. It helps to improve the nurse skills in nursing field. Then recognize various factors or causes to see that which is the cause responsible to cause the illness in that patient. Then self-expression. It gives a student an opportunity for self-expression. Then patient as unique individual. Every individual is unique. So patient is having other different types of needs and preferences. So a student should see a patient as a unique individual, then it helps the student nurse to coordinate with other health workers like doctors, pharmacists, other nurses, etc. So these all are the uses of case study. Now we are going to see the advantages and disadvantages. Advantages. The first advantage is solve nursing problems. It helps the students to solve the nursing problems by the case study. By taking the case study or by doing the case study, a nurse can solve the problems which are faced in the day-to-day life of the nurses. Then establish details in mind by assessing the patient or assessing about each of the system of the body, or by previous or by past experiences, a nurse can establish details in the mind, details about each and everything in the mind. Then help to integrate knowledge. It helps the student nurses to integrate the knowledge of various subjects in the field of nursing, like this method. So the various subjects means like nursing foundation, medical, surgical, sociology, and education and communication, like these things. The student nurse can help to integrate knowledge. Then improve care to patient. It helps the student nurses to improve the general care provided to the patients. Example, if a patient is having tuberculosis and a nurse had given that patient supine position, and she had seen that that patient is still not able to take the breath properly, or is not able to take the breathing properly, then that nurse then gives Fowler's or semi-Fowler's position to that patient. Then that patient is able to breathe at some extent. So that it improves the care given to the patient, like general care which is given to the patient. It helps to improve that care. Then record observations systematically. Record observations systematically means if the patient is having UTI and a nurse is to be assigned, that nurse should see or check for the urine of that patient, means a patient is having urinary tract infection and that patient is to be seen by a nurse about that urine from day to night. About the color, frequency, amount, and the content, all those things are to be observed by the nurse. In the morning she had seen, in the afternoon she had seen, she had recorded all those things from morning till evening in a very systematic way. So it helps to record observations systematically, means according to a system she has to be recorded that observation systematically. So what are the advantages? First is solve nursing problems. It helps the student nurse to solve the nursing problems in the day-to-day life from the past experiences. Then establish details in the mind. Establish details in the mind about after the assessing of the systems, acknowledging those knowledge in the field of nursing, she is able to establish the details in the mind. Help to integrate knowledge. It helps the student nurses to integrate knowledge of the different subjects like medical, surgical, nursing foundation, education and communication, sociology, etc. Then improve care to patient, means it improves the general care which is provided to the patient, like for example hair care, nail care, feet care, hand care, back massage, etc., or position or comfortable devices, etc. Then record observations systematically. It helps the student nurse to record the observation in very systematic way. So these are the advantages of the case study. Then there are some disadvantages of the case study, as case study is of 5 days. So case study is a time consuming. It is time consuming. Why? Because it takes 5 5 days, before 5 days we can't able to take another patient for another case study. So it is time consuming. Then then the student may not be able to give care to other patients at that time, because that patient, that nurse is to be assigned for that patient. She has to give care to that patient, and other patient might have feel like they are neglecting, or they are having the left out feeling in them. Then the student may not be able to give care to the patient after a definite period of time. Means after the patient, after those 5 days, a student nurse, after the completion of that case study, the student can't able to give care to that patient again. So after a period of time, that student is not able to give care or provide care to that patient anymore. Then the patient selected for the case study may develop an emotional attachment and dependency on the student providing care, which may interfere with the terminations of therapeutic relationship. Like if a patient is in those 5 days, when a nurse is talking with that patient, giving psychological support and talking everything with the patient, then a patient might have that emotional feeling or attachment with that nurse. So the patient can forget that therapeutic relationship with that nurse, or the nurse can forget about that therapeutic relationship with that patient. So these are the disadvantages. The first was time consuming. Second was the other patient might think they are neglected or left out. Then third is that after a period of time, that patient should not able to get more care because of the neglectance or because of the completion of the case study. Then the last is that patient or nurse then the patient or the nurse may have that forget that therapeutic relationship between the patient or the nurse. So these are the disadvantages. So I told you about the case study. So what is case study? Case study is a 5-day procedure, and it helps in the analysis and assessing, and it helps in the learning of the student. Then there are 2 steps in the nursing case study. First includes the patient, about the history of the patient, about the present illness, about the treatment, and about everything related to the patient. Then the second part of the case study includes the nurse, or the responsibility of the nurse, which includes the care which is to be planned for the patient is to be implemented on that patient. Then there are some uses, then some advantages which are there, then some disadvantages. 4 disadvantages are there. So this was all about the case study. So moving towards our next topic, that is case presentation. Case presentation. So I had told you about the case study first, and now we are moving towards another topic, that is case presentation. So what is case presentation? That we know that what is case study. Case study is a method that from selection of patient till the patient discharged. It is a 5-day process. Then now what is case presentation? Case presentation is not different, but case study, it's same as case study, but case presentation, as the name from case presentation means presenting that case study, is called as case presentation. So this case presentation includes selection of patient. This case presentation includes selection of patient, assessment of patient. Then according to this assessment of the patient, the care is to be planned. Then according to the care planned, the care is to be implemented on the patient. Then after this implementation, of the care, the patient is to be discharged, and then after the presentation of the case to the physician. So why there is a need to present that case study? There is a need to present this case study because by presenting that case study to the physician or in front of the doctors or other nurses, if I'm the one who is presenting that case study, so I have to tell about the about everything about the detailed thing about this patient, that this patient is having this diagnosis, or this patient is having these many things, or this patient is having these diagnoses, and it is having these types of medications. So these all things about all the type of clinical information I have to give about this patient. So this case presentation gives the detailed information or detailed knowledge about the patient to the doctors or nurses, or to the or to the instructors, or our nursing instructors, under which the student nurses are performing these types of case presentations. So this process is the process of case presentation gives a knowledge to the students to learn more about that case, about the patient as an individual, about their disease, about the anatomy and physiology of the those that case, about the anatomy and physiology of the system. Like patient is having tuberculosis, that earlier had given you example of tuberculosis. So if the patient is having tuberculosis, so there is an opportunity to learn more by conducting these case presentations, that the student nurse can learn about the system, respiratory system. That respiratory system consists of these many things, or like that. The student nurse have an opportunity to learn more about that case, about that disease, about the anatomy and physiology, etc. So what is the definition of this case presentation? Nursing case presentation is a formal communication, like it's a type of a communication between a one who is conducting or who is performing that presentation, and to the others who are listening, means the doctors or pharmacists or other nurses or other health workers. So it is a means of formal communication between healthcare professionals, which includes doctors, pharmacists, other health workers, and other nurses or therapists or nutritionists, etc., regarding a patient's clinical information. The purpose of this all information between the physicians, so that the listening physician should understand about the disease, or about the case, or about that particular patient, that the patient is having these type of diseases. So this all is about the case presentation. Case presentation is nothing but after taking that case study, if after that case study the presentation of that case study is known as the case presentation. So this all was about case study. And now after the case study, the presentation of the case study, means here is a nurse who is conducting the presentation. So that nurse is presenting that case to other health workers and to the doctor also. So this was about the case presentation. Now, what are the methods of case presentation? Like there are different types of method. Like in the case study I told you about, there are different types of steps. There were two steps to conduct the case study, and there are several type of methods of case presentation. So those methods includes introduce the patient with the help of his or her demographic data and health problems. Like normally we did the case studies and case presentations. First, the case study or case presentation includes the demographic data about the patient, means about the name, sex, age, the place where he is living or he or she is living, or about the nationality, language and caste, etc. These all things includes the demographic data of the patient. Then includes explain the patient's health problems, means the sign and symptoms and what is the present illness of the patient. That is included, that is to be taught to in the presentation. Then introduce the history of the patient, means history of present illness, history of past illness, history of medical or surgical, about the bad habits, about the socio-economic status, about everything. Means history includes everything, not only the disease condition, not only the medical or surgical history, but it includes so many things like bad habits, the history of the conditions, disease conditions, medical or surgical, means if the patient had ever undergone to any surgery. So like that, a history should contain all the detailed history of the patient. And then after history, there should be explain the patient's health problems. What are the health problems patient is having right now? So explain those things to the health workers or to whom we are presenting the presentation. Then detail any and all previous treatments. So give the detail about the present treatment and all the past treatments which patient had ever undergone. Then list out the assessment findings. Means the assessment findings means the after conducting this physical examination, you have to tell about all the findings, like if patient is having chest pain or cough or anything like that, then it should be told in the assessment of the patient. So these type of things should include the are included in the case presentations. Then after the physical examination or the assessment of the patient, what are the treatment, like what are the treatment which is to be received by the for the disease of what are the treatment which is received by the patient for that disease or to treat that disease. Then explain the nursing diagnosis. There should be 6 nursing diagnoses for one case study or case presentation. So explain the nursing diagnosis, that what is the goal of that nurse, that which care is to be provided to the patient. Then according to that, the care should be provided, then that care is provided to the patient. So like that, you have to told to the doctor or pharmacist or to whom we are presenting that presentation. So explain those things, that what is the nursing diagnosis or what is the planning or goal of that nursing diagnosis. So explain those things. Then what is the goal of that nurse for the patient, to give care or to provide care to the patient. Then explain all the nursing goals or support this with the appropriate examples. Support those goals should be supported with appropriate examples, that if comfortable position, like you said, comfortable position should be given to the patient. Which type of comfortable position should be given to the patient? Like Fowler's position, if the patient is having tuberculosis, Fowler's position, semi-Fowler's position, like that you have to support your answer, support that sentence, support that goal of the nurse, that like that this thing is happening. So the method of case study includes everything, each and everything. Means after the case study, presenting that presentation, whatever is there in that case study. So here are some advantages and disadvantages of case presentation. So let's see the advantages of case presentation. First advantage is opportunity to solve problems. It gives a student nurse an opportunity to solve the problems with that experience from that case, by taking that experience from that case presentation. Then opportunity for public speaking. It gives a student nurse an opportunity for public speaking, as she is having a platform and a stage to speak up there. So after that, she is having an opportunity to speak in the public. Then the third is improve understanding and relationship. It helps to improve the personal understanding and relationship with the instructor or with the healthcare members. So it improves the understanding and relationship. Fourth is knowledge and skills by discussion. By the process of discussion, it provides the knowledge and it makes some skills in the student nurses. In the group of student nurses, by discussing, it provides the knowledge and makes some skills in them. So, it gives knowledge and skills by discussion. Then the fifth one and the last is feels thrill of achievement. Feels thrill of achievement means a student nurse is having that feeling of thrill of achievement. Like example, like there are a group of 10 student nurses. If one is giving her case presentation, then other 9 are seeing her presentation as she is presenting very well. So other 9 student nurses used to think like they are like she's presenting so well. If I'm not gonna present more well than her, or I'm not gonna present that much good like her, then I will be failed. So like that, they're having that feeling of thrill of achievement. So to achieve something, to achieve that goodness, to achieve that she is the best, they need, so that feeling is there in them. So there is a thrill of achievement, feels thrill of achievement. So there are 5 advantages: opportunity to solve problems, opportunity for public speaking, improve understanding and relationship, knowledge and skills by discussion, feels thrill of achievement. So these were the advantages of case presentation. Now we are going to see the disadvantages of the case presentation. So what are the disadvantages of the case presentation? A student nurse who is having good verbal skills may dominate the presentation. Means the student nurse who is having the good good verbal skill quality, she can dominate the presentation very well. And the student who are very quiet and the student who are very quiet, they are not participating in that presentation. So that is the disadvantage, that is the first disadvantage of the case presentation. Then the second is without proper preparation or without enthusiasm. If that a student is preparing, then that preparation is very boring and irritating. That presentation is very irritating and very mundane activity. So this was the second disadvantage is without preparation. If the student is giving the presentation, then that presentation is not that much good, and it will be very irritating and very frustrating and very boring. So this was the second disadvantages. Then the next disadvantage is if the teacher had not guided the student properly that what should be done, or the teacher is not interested in that clinical teaching of the student, then the presentation presentation appropriately to make good presentation. So the student should guide so the teacher should guide the student about how the presentation is to be given. If the student is not knowing that how that presentation is to be given, then that presentation is not that much effective and that presentation is not clear. So the third disadvantage was that. Then now the last disadvantage is there is a chance that actual patient care may not be compromised if all the students spend time in that conference room for presentation. That was the fourth disadvantages. So I had told you about the advantages and disadvantages of the case presentation. So today I have told you about what is case study, what is case presentation, then what are the steps of case study. There were 2 steps. One includes patient, another includes nurse. Then some uses of case study, then some advantages and disadvantages of case study and case presentation, and some methods of case presentation, how the case presentation is to be presented. Then what are the advantages and disadvantages of this case presentation. So I had told you about case study and case presentation. So now if you're having any query, you can ask me, and your assignment is that all the students have to use this knowledge in their clinical field. So this is your assignment, and if you're having any query, I'll make sure that I'll clear your doubt. And thank you very much for listening, and thank you.